discussion. Okay, so hello once again, everybody, and welcome to the Penn State College of Medicine Navigating Primary Immunodeficiency Community Health Partner ECHO series. We're delighted to bring you this very important series with our partners at the Immune Deficiency Foundation. My name is Melissa, and I'm with the Project ECHO team. Before I get to our regular announcements, let me ask my ECHO partners to please introduce themselves. Caitlin?
Good afternoon, everyone. I'm Caitlin. I'm an education program coordinator with the Project ECHO team. I'll be helping out today with attendance and some behind-the-scenes data collection.
Thanks very much, Caitlin. And Jesse? Did we lose Jesse? Oh, we having audio?
Yeah.
Okay, Jessie is also part of the ECHO team. She'll be here also helping with some data collection. This is moving day, so I apologize. Our offices are moving, and we're all trying to find quiet corners to do our session today. So we're a little discombobulated. Let me move on now to our regular announcements. We do ask you that you not share the Zoom link with anyone, but instead, please have them contact myself, Jesse, or Caitlin to get the registration link for the series so that we can get them all registered. We do ask that during the session, you stay muted unless you're speaking. Closed captioning is enabled if you would like to use it. Just click on the CC icon on your screen, your Zoom screen. We also ask that if you're able, please turn your video on for the entire session. Not only does this help put names and faces together, but we love to see all the smiling faces in the session. Please remember that no protected health information or PHI is allowed when discussing your experiences with patients or clients. We are recording these sessions and they will all be made available to you, as well as all materials and resources used or mentioned in the sessions after the session. You need to email me the request for a recording after our session, and you must be a registered participant to get that recording. Please also respect the fact that we cannot give any personal medical advice during the session for you or your patient or client. Our partners at the Immune Deficiency Foundation have excellent and extensive resources and information on their website, which I put into the chat. That link will also be in the follow-up email that you will receive tomorrow. So I encourage you all to take a look at that site. In the spirit of ECHO's all teach, all learn education model, we will all be on a first name only basis during our sessions. But most importantly, what this means is that everyone is here to learn, participants and panelists alike. And I'm going to ask you to only use the chat for questions or suggestions as a last resort. With so many people in this session, which is wonderful, the chat can very easily take over the session. It makes it difficult for people trying to pay attention to the live discussion to also read the chats. And so I'm going to ask you to please either unmute and talk or use the raised hand icon, and I will call on you. If you absolutely must use the chat and you see a chat in there, please hold off until we can get to that chat. But again, we hope that you will just simply unmute or use the raised hand icon. And finally, if you're logged in with just a phone number or you have others joining you who are not logged in, please reach out to Jesse or Caitlin with a direct message so that we can count everybody for our attendance records. Okay, that's all of our announcements. We'll move on to our session. We're going to begin with a flash talk on mental health and caregiver fatigue, such an important topic. And that will be presented by our guest speaker, Jody Taub. We'll ask her to introduce herself in just a moment. Following the talk, we have a shared experience and challenges that will be shared by Dr. John Seymour, one of our participants, who's a staff therapist with the Journeys Toward Healing Counseling Center in Minnesota. Thank you again, John, so much. I think we're going to have a wonderful discussion about the challenge that you shared. I will be facilitating the session, just kind of directing traffic. As with the ECHO model, we always begin with participants. If you missed our first session where we talked about the model, you'll just follow my cues. Let's move on to some introductions of our panelists, and we'll begin with Diana.
Hi, my name is Diana, and I am the mother of a child with PI.
Thanks very much. Ken?
Hi, I'm a patient with PI. My name's Ken Bass. I'm a patient with PI I also serve with IDF as a Get Connected leader, which serves as a support group for others with PI here in Texas.
Wonderful. Thank you. Paula.
Hi, I'm Paula. I am a physician that takes care of patients with primary immunodeficiency here at Hershey Medical Center.
Thanks very much. Megan.
Hi, everyone. My name is Megan Messick, and I'm the Director of Education at the Immune Deficiency Foundation.
Thank you. And Colleen.
Hi, everyone. I am a registered nurse and the manager of medical programs at the Immune Deficiency Foundation. I am also a patient, and we have 2 young adult children with PI.
Thanks very much, Colleen. And our special guest speaker, Jody Taub. Jody, could you just introduce yourself briefly for us? Oh, Jody, you're muted.
My name is Jody Taub. I'm a licensed clinical social worker. I have a private practice in New York. I specialize in chronic illness, particularly patients and caregivers who live with primary immunodeficiency. And I am a patient myself with a primary immunodeficiency.
Thanks so much. And while you're unmuted, I'll share my screen and we'll get to our flash talk. Let me get through all our introductory slides. There are disclosures, another disclosure slide. And then Jody, whenever you're ready, just let me know when to advance the slides for you.
Great. So I'm presenting today. I'm very excited, Melissa. Thank you so much for having me on mental health and caregiver fatigue. And I already introduced myself. So some of the objectives we're going to speak about today are caregiver burnout, understanding complex medical trauma, neutral strategies to introduce mental health resources, encouraging mental health support, mental health resources, and I have my references at the end. So caregiver burnout is very common amongst caregivers of all different types and dealing with all different diseases. But caregiver burnout with primary immunodeficiency can be chronic and ongoing because there are ups and downs that go along with living with and caring for someone who has a primary immunodeficiency. So caregiver burnout is a stress response as a result of being overwhelmed by the responsibility of managing a loved one's physical and emotional needs.
Great.
That's okay. So caregiver burnout symptoms, we'll often see fatigue. Sometimes caregivers will withdraw from relationships and other personal commitments and decrease feelings of joy and fulfillment. On the part about withdrawing from relationships, what may happen is that caregivers may not have the time to invest in certain relationships, but also they may feel that certain people don't support them, and this can lead to isolation. So this is very common to see, and is important to recognize that sometimes caregivers will end up feeling isolated from others. So common caregiver feelings can be shame, guilt, anger, isolation, and resentment. Shame could come in many forms, but often caregivers will talk about, because I do work with caregivers, and I will pitch in and talk about it a little bit later, that I do run the 2 caregivers groups for the Immunodeficiency Foundation. And the shame can come from feeling guilty, feeling badly that, you're burned out or you're annoyed or you don't want to do some of the responsibilities of caring for the person you love who's actually going through the illness themselves. And so sometimes caregivers will feel that they shouldn't feel that way because they're not going through the illness. Sometimes caregivers can feel angry, isolated, and resentful of the role. Most caregivers didn't choose this role. They didn't know, that their child would be born or their loved one would be born with a primary immunodeficiency. Or sometimes care partners, their significant others were diagnosed at a later point. Caregiver burnout can lead to mental health conditions such as anxiety, depression, and post-traumatic stress disorder. And that's why it's really important to acknowledge caregiver burnout, because it can lead to clinical mental health symptoms that will that can be difficult to manage, but also will make it harder for them to function as a caregiver. Next slide. So contributing factors to caregiver burnout for families and loved ones with PI. So medical case management, there's so much to manage, having to deal with insurance companies and setting up all of the appointments and staying on top of all of the things that go with managing a major major physical health issue. Financial burden. So this is not, I always say this is not a cheap illness by any stretch of the means. And not only can the cost of medications be expensive, but time off from work to care for your loved one. Compassion fatigue, feeling like you're always having to care for someone else and having to put your own feelings or your own emotions or your own life on hold. Major life changes and stressors. So anybody, in their lives outside of caregiving. So they could have a change in job. Someone could be going through a divorce, or there are stressors, other stressors at home. Caring for aging parents and children. So many caregivers can be in that sandwich generation where they might be caring for younger, children or loved ones who have primary immunodeficiencies, but also they still have the responsibility of caregiving for their elderly parents as well. And that can really put a lot of pressure on care partners. Changes in the caregiver support system. This is really important. So if a caregiver had their own support network, which might include a significant other, or it may be their own parents, and that changes and they are then left to have to care for things on their own, or if they lose, friends or family who move other places that that had given them a lot of support. It could have been physical support. It could have been picking up children and loved ones from appointments or caring for meals. Then they have more responsibility on their hands. Decreased time for daily obligations and self-care. A lot of times I will hear care partners and caregivers talk about the fact that they would love to do self-care if they had some free time. So next slide. Understanding complex medical trauma. So medical trauma is a newer term in the last, I would say, 10 years that we're just starting to acknowledge and educate people about. Medical trauma is witnessing a loved one who is experiencing human suffering. Either a life-threatening illness or experience with medical trauma is traumatic. And many of our patients have experienced severe life-threatening infections, and our caregivers have been a part of that. Medical trauma is different than other forms of complex trauma because it's chronic and the stressor comes from within. So complex trauma is different than acute trauma. So acute trauma would be something that happens in a moment, like a car accident. You're not going to continuously be having a car accident, but that particular experience may be traumatic. Complex trauma is when the trauma is ongoing. And so with medical trauma, there is going to be ongoing trauma if there are changes in a person's medical circumstances. If we have a global pandemic such as COVID, there's lots of different factors that can lead to that. And the other part that I want to stress about medical trauma that makes this very different than other forms of trauma is that medical trauma, the trauma comes from within, often can come from within. The person has experienced a traumatic response to an illness, a acute flare, a medical experience, where other forms of trauma usually have an outside environmental trigger. In addition to that, the medical trauma can also be useful. So we don't want to shut off that fight or flight response, because that fight or flight response, allows us to know that something is wrong. And if we shut that off, it sets off this fight or flight, and we need that, like, oh, wow, I stubbed my toe. I need to receive medical care. Or, oh, I'm bleeding. I should probably put a Band-Aid on. So we do want that fight or flight response. But the problem is with medical trauma is that because of the chronicity of the illness, it can lead to increased mental health symptoms. Next slide. Medical trauma triggers and stressors. So a medical crisis, change in health status, and medical instability, isolation, both physical and emotional, shifts in medical care team or shame and misunderstanding from medical professionals, grief or loss, and a lack of understanding from others about rare disease. Rare disease experience is very different than other known diseases because you're in the position of constantly having to try to explain what the disease looks like to other people. Managing the emotional regulation of your loved one. So the person who has the primary immunodeficiency may experience their own mental health symptoms such as anxiety and depression, and you on the other end may have to try to table your own feelings to help the person that you love. So in talking about caregiver burnout and also medical trauma, I provide this information so that you all have a background when you're working with caregivers and care partners who support patients with PI, because they may get triggered at different moments that might seem obscure, or their response might be out of context of the circumstance. And if you can understand the background, it will help you to be more sensitive to some of their feelings or responses. So the neutral strategies to introduce mental health support resources. I always say this, start off with validation. Validate their experience and how hard it can be to be a caregiver. Often caregivers don't hear this. They don't hear about their role. It's about the person that they love. That's the role. You know, I'm so sorry that this person has a primary immunodeficiency, but we don't talk about how hard it is to be a caregiver. Emphasize the benefits. So talking about mental health benefits, and starting off with talking about the benefits rather than talking about how the person may be experiencing mental health symptoms. You may have somebody might become defensive if you start at a place of talking about depression or anxiety or some of the things that they may feel shame around. So start off with talking about it from a validation and a beneficial experience. Normalize that mental health support is a part of managing physical health. So if we can do that and we don't look at it as you don't know how to cope, because I think that's one of the things that gets in the way often of caregivers seeking support is they feel, well, wait a second, why can't I handle this? Or if I seek mental health services, this may mean that I don't have good coping strategies and people don't understand how hard this is. So bridging the gap to let them know that medical health and mental health are part of managing primary immunodeficiencies is really important. Present various options. So there are many ways to support caregivers, and it doesn't have to necessarily be therapy or a support group. There are various options, and they may want to have the agency to make a choice. So if you could provide these resources at their leisure, it'll help them to feel like they can choose what might work for them. Next slide. Encourage mental health support. So when we're better able to manage our mental health, it makes it easier to be a caregiver. So benefits of improved mental health. These are some talking points that you can utilize with some of the caregivers and care partners you meet with. So managing mental health helps with problem solving capabilities, which allows us to better tackle our physical health demands. It increases the ability to maintain close relationships and support, which decreases isolation and loneliness and improves overall physical health outcomes. Easier to manage transitions with flexibility and the roller coaster of living with primary immunodeficiencies. Acknowledge that friends, family, and loved ones may not understand how you need support. So being able to to utilize some of the mental health resources will help caregivers when they interface with the people that they love and help them to understand how to talk to them about how they need to be supported. And in a 2020 study on social support, stress and life satisfaction impacts adults living with rare disease, companionship support was the most important for satisfaction with life. We really want to help our caregivers to get the support that they need from the people that they love. And part of that is to balance their mental health so they can bring people into the fold rather than feeling isolated because they think other people don't understand. So here I've listed some professional mental health resources which you can provide. So there's talk therapy, which is traditional sit on my couch and tell me your problems. So there's different forms of talk therapy that we know are helpful for patients in general who live with chronic healthcare conditions. So ACT is acceptance and commitment therapy, CBT is cognitive behavioral therapy, MBCT is mindfulness-based cognitive therapy, and MBSR, mindfulness-based stress reduction. I always put the Psychology Today link because people always ask, how do I find a therapist? I find the Psychology Today resource very helpful because the therapist directory is the largest database of therapists in the United States and psychiatrists. And you can put in your zip code, you can put in different healthcare, you can put in chronic healthcare conditions, you can put in your insurance to find people in the area who might be a good fit. Psychiatric assessment for psychotropic medication evaluation. There are many patients who have primary immunodeficiencies who will need psychotropic evaluation, and sometimes caregivers may be experiencing clinical and mental health symptoms that will require a psychiatric medication evaluation as well. In conjunction with that, there is genetic testing for psychotropic medication. So the two sites I've provided are GeneSight and GenoMind. And what this is someone does a swab at home, and if they're looking to be on psychotropic medication, a psychiatric nurse practitioner or a psychiatrist who is trained will be able to take a look at the results and see which psychotropic medication may be the right one for you, and patients wind up with more directed care. And then I highly recommend the IDF Caregiver Support Group, which I lead. It's once a month. It's for, the Immune Deficiency Foundation offers this as a free resource. The support group is divided. One night is for loved ones who are taking care of children or young adults, and the other evening is for support care partners who are spouses or significant others. And they can sign up by going to the Immune Deficiency Foundation website. Other mental health resources. So Immune Deficiency Foundation Get Connected groups are wonderful. This provides peer support with other people who are going through what you may be going through. And I know that there are also caregiver peer support groups. The Immune Deficiency Foundation also has Facebook support groups, which can be really nice to tap into a lot of other people around the country and around the world who are caregivers of loved ones. Immune Deficiency Foundation educational programming for mental health, such as what we're doing today. There are a variety of lectures, podcasts, articles, and additional support. And then I added the Immune Deficiency Foundation website, which is www.primaryimmune.org. These are some slides, and we certainly can go back to it. I just added some extra mental health resources. So some apps for mindfulness and meditation resources, such as Smiling Mind, Insight Timer, and Headspace. Next slide. Here are some additional books about mindfulness and meditation. Next slide. So the key takeaways from today is that managing mental health is a key component to supporting a patient with a primary immunodeficiency disease. As a trusted provider, you can play a vital role in helping caregivers incorporate mental health support and direct them to available resources. These are a list of some of the research references. And this is me, if anyone wants to get in touch with me, and I'm sure, Melissa, that you will provide some information
Absolutely.
regarding references and resources. So
Great. Thank you so much, Jody. That was a wonderful talk. And just to remind you, everyone will get that presentation with all of those great links and resources in the email that I'll send you tomorrow. Before we move on now to our shared challenge and experience that John has brought to us, does anybody have any questions for Jody? You must have covered it really well, Jody. All right, if you think of any, you're welcome to ask those during our discussion. If not, I'm going to share my screen again and we'll turn to John, and he's going to give us the details of his experience and challenge. And then if you were with us for the first session, we followed the ECHO model, which is to ask questions first and then suggestions second. I'm going to change that up a little bit for the sake of time, and we'll ask participants to go first, asking any questions you might have for John or our panelists, and also sharing any suggestions you might have. John gave us a list of some really good questions. You should all have received this with the email I sent you yesterday. And then we'll end with our panelists' questions and suggestions. So let me share my screen once again and turn things over to John. If you'll just read your experience details right from the slide whenever you're ready.
All right. Well, thank you so much to Penn State and IDEA for having this educational experience. I've worked also in this field for a very long time. I've retired from Minnesota State University, professor emeritus, and first started working in the field of working with chronic illness and families. What I didn't know that I would become the parent and the spouse of PID patients, and that would lead me to the Immune Deficiency Foundation and 20-something years of volunteering with them. But this is a kind of an experience that I think is pretty common. Introduce you to Marla, who's a 38-year-old female, married. She has 2 children. She's been diagnosed with common variable immunodeficiency disease, CVID, about 2 years ago. And she's currently receiving IVIG therapy every 3 weeks, and she's seen gradual improvement, less frequent and severe infections, generally a better health picture. That said, she still gets frustrated with the degree of discipline that one has to live in order to deal with a chronic illness, the kind of the grind of going from that temporary illness to a chronic illness. So even with her best efforts, sometimes she feels overcome with the sense, and she has self-doubts about her own efforts at managing the disease. The thing is that, and here's that family therapist part of me talking, her self-doubts have also been reinforced by comments from others recently. Her spouse has been asking things like, well, how long exactly are you going to have to do these infusions? And so when are you going to be completely done with taking them? Her 8-year-old has gotten impatient on some infusion days about it taking mommy's time away, and gets in the way of things that the 8-year-old would like to do. And she echoes dad's sentiment of, okay, when is this going to be over someday? And then she has a coworker at work that reminds her on almost a daily basis at the water cooler, the pop psychology and pop health solutions for instant health. If you will just do activity X or take supplement Y or go see professional guru Z, you would be ahead of this and it wouldn't be affecting you anymore. So the point of this is that many PI patients, chronically ill patients, patients with rare disease, they have times of feeling stuck and discouraged, and their families get stuck and discouraged. The caregivers do as well. And it's complicated knowing sometimes where to start and kind of what all is involved. So I invite you to look at this story and think about the different medical, mental health, relational perspectives that might come to bear to really be helpful. And as Jody mentions, it's a hidden challenge of this is just how little understanding there is of really what it's like to deal with a chronic illness versus an acute illness, or a very rare disease versus a more common and shared disease. So wish you well with the discussion.
Thank you very much, John. That's a lot to think about, and it seems to be a very common challenge from the faces I'm seeing on the screens. So we'll open things up first to participants. I'm just keeping these questions up on the screen for a little bit longer so you get a chance to take a look. Any clarifying questions that you'd like to ask, if there's more information you might want to know, or what suggestions would you have for this person? Just go ahead and unmute if you'd like to ask a question or offer a suggestion. There's lots of wisdom here in this room, so let's help John's patient out.
I think that it will be great for her to have somebody with she can talk to, just to vent all the what she's going through and all the things that sometimes our significant other and family, they don't fully understand what we're going through and all the things that we need to organize and to balance what we are dealing in our health and also the family, our family situation. So I think it will help her a lot if she talk with somebody to help her to talk about this, to vent and find solutions if it's possible, and why not to involve the significant other too in some point for him to understand and be the supporting person that he should be. Yeah. That's
Absolutely. Thank you, Monica. That's wonderful. I see you're getting applause from Laurel as well. So that sounds like an excellent suggestion. Anyone else have another suggestion or question? Some thoughts? Laurel, go right ahead.
Hi, good morning, everyone. So I was in a position where I have common variable, and my mother had cancer and was in the dying process. And when I was in Florida and she was in Chicago, so it was completely overwhelming, not just emotionally but physically. And what I had to work into, and I'm saying it's a constant work into in terms of a mindset, is to have realistic expectations for yourself and for what the caregiver is asking you to do and so forth. I really believe there's a tremendous benefit of having a different mindset in terms of saying, like, even for me as a patient, instead of saying I have to do IVIG, I say, I am so thankful that I have authorization that I can do IVIG. So flipping into a positive mindset really does offer a lot of significant benefit for yourself, for your mind, for your body, because your brain then is spinning it into a positive light. So with Mom, she was scared, I was scared, we all were scared. And I think that having little talks, multiple little talks, and knowing that you're going to have to continue to regroup and go back to the talk of saying, working out a schedule, her care schedule that works out, identifying other people in our circle that can possibly take some of the load off. And I'm a very compassionate person, but the fatigue was so real that there were times where I ended up exploding and screaming at her, or she's screaming at me. And that's the last thing we ever want to do. So I would also say take a time out if you are really feeling like you're at wit's end, to allow yourself to say, you know what, let me take 5 minutes or 10 minutes to regroup, because we don't want hurtful things to come out of our mouth or negative things to someone that we love, but it is very natural for it to occur because the pressure involved is so much. Regarding the expectations that we have for other patients to fully understand, and I don't mean to say this negatively, but if somebody had cancer, I think the world outside understands cancer and they're like, oh, she has cancer, that family has cancer. But we have, in a sense, an invisible illness, and they don't understand, like, when are you going to stop doing these infusions? When is all this going to end? It's not going to end for us, for them, for anybody. So having realistic expectations of how our family will respond to us, how our friends will respond to us, of, you know, being carved out of an event or something because, well, every time we call you, you can't come. Then say, I really express to your friends that, number one, what is going on, that it's a lifetime thing. And sometimes we have to tell people how they can best support us. We can't just it's forgive me, men, but sometimes men with our husbands or whatever, we have to tell them how they can support us. Tell our friends, you know, bringing 17 meals isn't good for me, but if you would be able to either pray for me or to, you know, speak with the girls on my behalf, and I can have one point of contact to explain what's going on, as opposed to a whole bunch of, you know, miscellaneous, everyone's trying to help you, but then that becomes overwhelming because they want to help you in your end. And finding a real quick, simple statement to explain the disease, whatever, you know, PI, whatever that system is, because so they don't have the need to give you supplements or, you know, you should just take some more vitamin C. And, you know, if I could, that would be fantastic, you know, but help them fully understand and not to be offended. You know, I think that when we're stressed and we have all the burden of all this going on, we do become more sensitive. And so not taking everything personally. And again, with your friends or your family or external sources that should be there to support you, give yourself like 5 minutes, you know, we can control the space between what happens or what somebody says to us and how we respond to them, and just be really cognizant of that.
Thank you, Laura. Lots of great suggestions in there. And John, I think you had mentioned in your question how poorly understood things like primary immunodeficiency diseases are as compared to something like cancer.
Exactly. And, you know, as Laurel shared her story, I've had experiences of kind of the reverse situation that with a patient with PID, with a cancer patient in the family, that young children dealing with cancer and the death of a grandparent, say, suddenly get very fearful when they have a parent with a primary immune deficiency on infusions. Well, isn't that what grandma was doing for her cancer? And it, you know, she's no longer with us. It's we don't understand it well. I think, though, Jody mentioned a phrase that maybe most of us in the helping professions talk a lot about and understand, but I don't think families do, and that's compassion fatigue. And Laura mentioned how so much of this actually comes from compassion. And there's lots of research to tell us how involved that fight-flight response within the home. It not only creates empathy, but it creates a lot of stress among family members and care providers. And we kind of understand that, I think, in the helping professions, that we have to take care of ourselves, but it's a new experience for families that have been used to, well, I'll help out with the dishes while you have a migraine. It takes a very different kind of conversation and understanding, but to help, I really try to help families remember this starts with compassion. If you didn't care for one another, you wouldn't be stressed right now. But you need new tools to deal with that stress, where you can feel compassionate, helpful, and cared for yourself.
Thank you, John. Those are all excellent points and really difficult to do all together. I'm going to just turn for a second. I know more participants might have something to say, but I'm looking at our panelists and I can tell, I see head shaking, and I wonder if one or two of you would just like to unmute and talk a little bit about that issue, caregivers who also need care, and also the lack of understanding for something like primary immunodeficiency. Go ahead, Colleen.
I'm going to take it in a different direction.
Okay.
I found that as I handled everything and just bounced back and forth and just kept going, that more and more and more of the comments were, oh my gosh, you do such a great job. Oh my gosh, you're just such an amazing mom. Oh my gosh, I don't know how to do it, how you do it, but you are just so spot on. You are just so amazing. So the more I got those kind of comments, the more I felt I had to live up to those comments, and the harder that got to be. And I felt I no longer had the right to say, I'm done. I don't want to be strong today. I don't want to do this today. But because everybody seemed to be so proud of me, for better lack of a word, how do you turn that around and go, I appreciate it, but I'm not as strong as you think I am, or maybe I'm strong on certain days, but I don't want to be strong every day. I'm exhausted, being exhausted, or pretending that everything is okay and that you have everything under control is the most exhausting thing I found. That it was so much more exhausting to be that person than it was to say, I need help.
That's a great point. So by putting you on a pedestal, and I'm sure that meant everything, but that adds a lot of pressure, I would think. Jody, do you want to speak to that a little bit for us?
Yes, I would. And Colleen, I'm so glad that you added that perspective, because it's not by choice. And that's what I was talking a little bit about in the validation piece, is letting others know how hard it is. And what I suggest in that is being vulnerable, opening up that conversation. When someone says, I don't know how you do it, you're so strong, say, some days I don't. It's really hard. And this is what I'm struggling with right now. So if you can open up a little bit of vulnerability to another person, it gives them a window to, one, understand your circumstance a little bit better, and two, it gives you that moment to connect with the person and for them to actually understand that this is really hard. Because one of the things that happens, Colleen, you were talking about, is when you keep it all together and it looks great, people then don't understand entirely how hard it has been on you. And that's where this comes in. So it's really important. And if you can, try to remember that acknowledgement and that vulnerability with that other person, and saying, hey, you know what? I make it look really good and I make it look really easy, but there's days where I really can't. And that's important for other people to know.
Thank you, Jody. Laurel, did you want to make a comment?
Yeah, with that, I think that it's so important to know that we are humans and we are not supermen. And sometimes we have to have realistic expectations of what we can do, and which means not to overcompensate and treat the patient, or I'm a nurse, so everybody's a patient, sorry. Not to overcompensate and do all these extra things which we think we should be doing. Allow the person, the daughter, the mother, whoever it would be, kind of try to normalize it all as just as easy as it is to, like, go brush your teeth or whatever. When we live up to this expectation that we have to be perfect and we have to do everything the way that, it puts so much stress on us. And even just to say that every day we're just going to do the best we can. And some days it could be ugly, like a dumpster fire. And other days, just, we can just have a gleaming moment with, that was just a beautiful day. Because when we're working to make everything all day long, it's like a work to do all these things. There's little joy in that, as opposed to just allowing things to kind of flow as they are, accept how they are, and find little special moments in it, like whether it's go for an ice cream or have a special quiet moment with each other. just not, I often think that the expectations we put on ourselves to provide that level of care, maybe it's overcompensated because we feel bad for them, but whatever it is, we just have to kick it down a notch.
Excellent. Thank you. Such great points. Other participants who want to chime in, ways you've explained things or help your clients, patients, or if you're a patient or caregiver, to children, to coworkers. We had an interesting coworker in that experience talking about what's on social media. If you're tired, just take a vitamin C, that sort of thing. How do you deal with that when it's such a complicated thing to explain to people?
I think that sometimes we are hard, just to complement what we were saying before, just really quick, that sometimes we are really hard on ourselves, and then we just continue doing it. And I think that, you know, we need to understand that it's okay not to be okay, and seek for the need that we need. And go back what you were asking is, I think sometimes also we had to understand that cultural beliefs, especially in our Hispanic communities, that is also sometimes have some things that stress cultural beliefs, language barriers, is a lot sometimes in some patients. And those are situations that make things more stressful than others. And there's, you know, we need to find the resources for help with the language barrier, to understand the cultural beliefs, for the patient to understand certain treatments and why things have to be done in certain way that maybe in their countries of origin, they're not the same way. And also there it comes that if you take this tea, it will help you. If you take this concussion of combination of things, it will help you. So it's a lot of things. So I think basically in my community, so there's a lot of those beliefs that we have to deal with and have to talk and make understand it to parents, family members, friends. There's a lot going on. Mm-hmm.
Those are excellent points, Monica. I'm so glad you brought that up. I know we have a lot of community health workers on the call with us, and you deal with many people from all different cultures. And so it's hard to balance, I'm sure, that respect for our culture along with explaining medical priorities. Paula, I wanted to sort of pull you in a little bit as an immunologist to that, but also the question John asked about the misunderstandings or how difficult it is to explain something like PI versus cancer and how you can maybe help people to do that. Thoughts from a medical perspective?
Absolutely, absolutely. This is such an interesting conversation, and certainly something that I encounter on a regular basis, but maybe accepting my own limitations and knowing that sometimes I'm not able to give the patient what they need. And this is where people like Jody really excel at helping bridge that area from the physician's clinic to when they're feeling either caregiver fatigue or fatigue of their own illness. In terms of understanding the condition, really is very specific to the immune system. That's what's happening, but so a way that could be easily, as Colleen was bringing up, hey, you know what, like the parts of my body that help me fight infections don't work so in the way that it works in a normal person. And so very little things can get me extremely sick. And this is going to be something that I will deal with probably for the rest of my life. And I'm managing it with different medications that can be sometimes very invasive. And so I feel like something limited, but also giving someone an understanding, if you wish to, of, hey, this is actually a pretty serious disease. There is something I'm doing about it, but this isn't just like a something that's not serious, something that I'll get over quickly, that it's something that I'm managing, and an understanding that yes, the medications that I need for this are actually like kind of invasive. They're not just taking a pill every day and I'm done. It's more intensive than that. And then with regards to, I actually kind of part of my clinic is taking care of patients with language barriers, and specifically, I see a lot of Latino patients. I speak Spanish, so we have like a lot of patients. Most of our Spanish-speaking patients get shifted to me. And yeah, absolutely, like any sort of language cultural barrier creates a new layer. So both from the physician standpoint, from the therapist standpoint, or any point of contact to that patient, it actually does require us to have an extra layer of compassion, understanding, and an ability to listen where the patient is coming from, and then explain things in a much more detailed way. I am still working on those things, because some ways that I explain things that might work well with a certain population don't work well with another patient population that have different belief systems. And so it's something that I'm constantly trying to learn more about. But I don't have all the answers with regards to that. I do struggle with certain explanations. Our Nepali speaking population, which we have a huge Nepali population that is mainly refugees from Bhutan in our specific area. And the way that they construct sentences and their view of the world is so different from my own and my own understanding, that I do struggle with being able to explain things in a way that works for them. So it's more about educating ourselves, educating myself constantly in terms of trying to reach and be able to deliver better care every time.
Thank you, Paula. That's very helpful. I'm going to kind of open it up as we're getting toward the end of our time, just for anybody with any other questions or suggestions. One of the things that came up in the experience was how to explain to children. And I know we have a lot of school nurses on the call as well. Very curious how you explain to children and how children can explain to their peers. If you're going to school and you have to go to the nurse's office a lot, you're sick all the time. I know we have some parents and caregivers here. Love to hear from you. Diana, you want to kick us off?
I would just say that the way I explain it, because my son and now my daughter, who's going through getting her diagnosis as well, we explain it in a short couple sentences, and I'll say, this is my son Emmett, and his immune system isn't like yours or mine. He has part of it that doesn't work, which leaves him open to having big, huge infections that can make him really sick. And the thing that usually resonates with the children that are listening, I was like, when it's a common cold for you or your family, and you're sick and you go to school still because it's a common cold, that would often put him into the hospital. And that is usually the realization, because they're not used to being in the hospital. So usually that's all I really have to say is his immune system isn't like a typical person's, and that it can lead to really big infections that could put them in the hospital. And that's usually the end of, the children are like, okay, and then some will be like, I got a cough, and I'm like, thank you for letting us know, and we'll back a little bit away. But especially with the children, I have a conversation with all the children that come into my house, and we have an open house. I'm fine with having anybody over, but as long as they know what could the potential consequences be for my family if we come over sick, and just explaining it to them like that. I think most children have understood, like, I've learned about enough immune system, especially with COVID and everything. They understand sicknesses, and it's always worked for us.
For thank you so much, Diana. I think that's so helpful. For child that has like more interest in the immune system, I know there's so much in terms of where they could get directed. We also, like in the Immune Deficiency Foundation, prints out these books about like zebras and things like that that can be very wonderful. I found that the best explanation I've had seen for children comes in a TV show called Storybots. And they have one episode on the immune system that is like brilliant. And I've actually shown it to like my fellows, like that train under me and stuff like that. It actually is just unbelievably well done. So that would be like where I would refer children that want to know more about the immune system.
Okay, interesting to know. That's great. We have just a couple more minutes. Anyone else want to add to the discussion, participant or panelist?
I really identified with the idea of people saying you should take this medicine or this vitamin and stuff like that. And as has been mentioned earlier, trying to keep that positive attitude and remember these people are caring about me and are interested in me, and start by saying thank you. Thank you for caring about me. And as a guy, I say, if your car engine breaks down, you can put all the gas you want into it and it won't go. And that's what's happened is the word deficiency, a common variable immunodeficiency, they see deficiency and think you should build it up. And that's where all the gurus and the medicines speak to. And so you say, no, deficiency, it means broken. And that was brought up earlier too, that it's a broken system, and a broken system can't work just because you put gas into the car. So
that's a great way to explain it. Yeah, excellent.
I would just chime in that I appreciate when Jody said about validating. So if you're a school nurse seeing these kids coming in and out and in and out and in and out, saying something to them about it has to be so frustrating to want to be in school, to want to be with your friends, and have this illness interrupt all of that fun. And just listening to them, just sort of making a generalized statement and listening to their response, and maybe saying to them, you know what, I'm here if you want to talk. And then maybe they can sort of push them in the direction of actually getting therapy, but they have a trusted person that they can at least know that it's okay to say, yeah, I don't want to go home and I'm really mad. I had this plan today, or I had that plan today, and now this hits again. And once again, I can't go. And maybe it's homecoming, which happened to my daughter, or maybe it's, something else that's even more important. To just acknowledge, I don't know the whys that this is happening. I don't know why you got what you got, but know that I'm here and you're not alone.
That's perfect. That's a perfect way to end, I think. So thank you, Colleen. Thank you so much, Jody, for that talk. And John, thank you for getting us all talking about that wonderful experience. We'll see everybody again, I hope, on October 30th. Our topic will be treatment options, and you will receive a session evaluation. We ask that you take a few minutes to take that evaluation, give us your feedback. The link expires in 7 days, and I will send everything to you, including all of the wonderful suggestions that Colleen's been jotting down that were put in the chat tomorrow with that email. So thank you, everybody. Have a wonderful rest of your day. Okay, if our hub team wants to stick around, we will debrief as soon as we clear this out. We're almost there. It takes a while. All right.
How wonderful. That was great.
How did you think the different way of operating. We kind of did it as a more of a conversation as a whole. Do we like that? Do we want to go back to the questions and suggestions? Whoops. We had somebody sneaking in here.
I actually thought this worked really well. I'd love to hear other people's opinions, but I actually thought this worked really well. Things flowed easily. So yeah, I liked it.
I did too.
Okay. All right. Others, we can always change back if you think it's working. What about the chat? We've asked people not to contribute. Do you think that's holding people back, or do we want to keep it this way? With a big group, I know how fast that can explode, but I also don't want anyone to feel like they can't participate.
I think you make it clear enough that if they need to, they can, but I think those that want to say something will.
Okay.
Well, I have to thank Jody, because now I feel like I've got to take my wife out to a thank you dinner.
Oh.
I would add to your list that she would say she gets frustrated because sometimes she feels like I don't care enough about my disease as much as she does. And so then when she's in the hospital emergency room with me, you know, and I'm got a high fever and, you know, delirious from being with infection, you know, she goes, you got to take this more seriously. So that's the other one. They get frustrated because the other person's not taking it seriously.
Thank you for all of those links and resources.
That was amazing.
People were direct messaging me saying, are we going to get these? Are we going to get? I said, you'll get them all. You'll get them all.
I figured, Melissa, I'm like, I'll go ahead and bait them now. They're going to get it later, but I'll ease the comment.
And I try to include them at the end of, you know, I created them for the Immune Deficiency Foundation and some of my presentations over the years and last couple of years. And I think it's just helpful. It gives people some different options. One of the things I wanted to make sure that everybody got a commentary on, but this also might